First it was Wuhan, then Italy and Spain. Now the decisions to lock down cities has reached the United States, with New York and Los Angeles shutting down bars and restaurants and some schools. Now it follows a surprise announcement by the US Federal Reserve on Monday that it was cutting interest rates and injecting billions of dollars to encourage spending. Despite this, Asian markets have closed down and there have been sharp falls too in the European market since opening. The French government has warned the situation there is deteriorating very fast. It is considering whether to now follow Italy and Spain into lockdown. We do have some good news though. In Seattle, the first human trial for a potential coronavirus vaccine is starting later. So let's go live to Dulles Airport near Washington, D.C. Gary O'Donoghue is there for us. Hugh Schofield joins us from Paris. Gary, if I can start with you, tell us a bit more about the measures that are in place where you are, but also in New York and Los Angeles.
Yes, we're starting to see substantial major shutdowns of the public school system here. That's the state-run schools. Something like 2/3, 32 million children are now being told to stay at home for at least a couple of weeks and possibly longer. So that's going to be have a huge impact, and of course, on them and their parents. 6 states have now banned bars and clubs and restaurants from opening, other than for delivery purposes. Other states, like here in the District of Columbia, where Washington is, have made certain restrictions on what you can do in those places. We're going to hear later on today whether there's going to be any further sort of social distancing or quarantine type restrictions. The president can take those powers to himself. At the moment, the Centre for Disease Control is recommending that there should be no gatherings of no more than 50 people at any one time. That's a recommendation. It can't make rules in that sense. In terms of the numbers, Lucy, just finally, we have more than 3,500 cases here in the United States now. 65 people have lost their lives, and the virus has reached 49 out of the 50 states.
And Hugh, to you in Paris, what measures are being taken in France?
Well, as we've been reporting, today is the day in which the raft of measures comes into effect, which include the closure of schools, nurseries and universities, but also it's the first day, working day, in which the closure of shops, non-essential shops, cafes, restaurants and so on has hit. So today is the first time in Paris that we're really feeling that life is changing and changing really drastically. But the question is that enough? Because what we've seen in the last few days is a sudden acceleration of measures announced one after the other. And there's certainly a feeling that we're detecting here in government circles that things may still not be enough. More may need to be done. There was a lot of irritation, we're told, over the weekend when government ministers saw pictures of Parisians out idling together in parks and along the River Seine in groups as if nothing had changed. And at the same time have come very, very severe, angry warnings from doctors saying, you still don't get it out there. We've got to change the way we live. And that may be why tonight President Macron has arranged another televised announcement, and all sorts of rumours going around now about what that might contain, with top of the list of those rumours the notion that he may announce a much tougher form of confinement a la Spain or Italy.
So, Gary, while we're talking about presidential announcements, there have been lots of conflicting messages in the US around the coronavirus from the president as well. How would you judge the levels of trust in what the government, scientists and experts are saying in the US at the moment?
I think people are listening. I think they're listening pretty carefully. But as Hugh was saying, I think the authorities are trying to work out, when and how to deploy these different kinds of restrictions, because the risk, of course, is that if you do too many small things, people won't do the big things, and I think that's one of their fears. So I think they're hesitating, for example, around the issue of domestic travel, whether or not to ban that outright or to restrict it to only the most small or the smallest number of cases. They're looking clearly at issues of greater amounts of working from home. How much will they impose that? We'll have to see potentially later on today. And meanwhile, Congress is trying to put some legislation through to give some help to people who will be losing their jobs or maybe off sick. Because you have to bear in mind in this country, there's no statutory sick pay. You don't get paid if you're sick in this country by right. Many companies do it, but you don't get it by right. And Congress is trying to rectify that, at least for some workers, not for all.
Hugh, it's been heartbreaking to look at the pictures and the situation in Italy with the health system on its knees and under so much pressure. How well equipped is the French medical system to cope with what's to come?
Well, it's well equipped and it's a good system. It's a generously funded system and everyone is pretty proud of it. But there are warnings that it's beginning to show signs of overload in certain areas. I've been just watching the television this morning, and down in the Haut-Rhin department, that's near Mulhouse, which is a real epicenter of the virus now, that they are talking now about running out of critical beds. In Paris, they're saying that there's a doubling in the last few days of the number of people being admitted to critical units in hospitals here. And they're saying also that not all of them are over 60 or the elderly. And this is one of the things we've got to understand out here in the public, that it's not just the old who are being admitted. So I would say that it's holding up, but there are hence these very angry warnings from doctors for the public to get real. They are worried that there might be overload.
Hugh, Gary, thank you both very much for joining us. Big changes in the US and France, but there's a new dawn for Spain too. The first workday of the national lockdown has brought an airy calm to the streets of Madrid, the stations as well. People are only allowed to leave their home to go to work, to buy food and medicine, or to go to hospital. And nothing we've seen really brings the desperate situation home more powerfully than this. I mean, can you hear her? She is gasping for breath here, infected with the coronavirus, but she is also grief-stricken because last night her husband died in this hospital, and now doctors have told her to go home. She's not sick enough for a bed yet. And her children here, as they comfort their mum, they are also, of course, putting themselves at extreme risk of contracting the virus. And in Italy, the whole country is entering its second week in lockdown. Despite that, the Prime Minister has warned of its riskiest weeks are still ahead, having announced the biggest daily rise in the death toll since the outbreak began. Giuseppe Conte is saying when this crisis is over, Italy is going to need a reconstruction plan. And China, listen to this, China is now organising flights to bring students and workers home from stricken areas in Italy. Let's show you Germany. It's the latest country to introduce restrictions on movement as well. Its borders with France, Austria and Switzerland are now closed to all but business and commercial traffic. This is the situation on the border here, as you can see. Well, let's bring you the latest from our correspondents right across Europe.
Well, the impact the authorities hope it's going to have is by totally clamping down on all movement here, that it's going to also clamp down on the spread of the virus. The impact on people's lives has already been immense, really. Over the weekend, what we've seen is the sort of ramping up of these measures, and people confined to their houses or told to stay at home. Anyone who was out, the police have been circulating in cars here in Madrid and elsewhere, spotting anyone who's out, telling them to go back home if they don't have a good reason, and those reasons you're allowed to be out for are very limited.
Today, the police are saying reportedly that they're taking people's word for it, but we're told that they will have to in future prove that they are going to or from their place of work if they're not to be turned away from the border. Long queues forming, as you can imagine, as those checks go into place. They began at 8 o'clock local time this morning. Not every German border has imposed these controls. The Interior Minister, when he announced the moves last night, said that they're in response to what they describe as hotspots of infections around the border, and that's what they're trying to deal with, to try to slow down the spread of those infections from those hotspots.
368 people have died over the last 24 hours from coronavirus in Italy. Almost 25,000 cases of coronavirus across the country. The situation is dire. Most of those cases and fatalities are in the north. Hospitals incredibly stretched there. Some doctors saying they're running out of essential kits such as ventilators and masks. And the Prime Minister says one of his priorities is to make sure that doctors and nurses are protected from the virus so that they can continue working.
The latest there from right across Europe. So what about here in the UK? Well, the government's strategy is proving controversial. It is yet to introduce the lockdown measures that we see in other European countries. Shops, bars and most schools are all still open. Tests are primarily being given to people requiring hospital treatment, not those with mild symptoms, but it is considering more targeted restrictions. The health minister says people over 70 and others with vulnerable health conditions will be told to self-isolate at some point in the next few weeks. Some parents, though, are threatening to take matters into their own hands, saying they will remove their children from school this week if the government doesn't act. Well, the Prime Minister has said, Boris Johnson, he's going to hold another emergency meeting later before holding a press conference. And this is going to be, I think, a daily feature, is this daily press conference. Let's take you to our political correspondent, Rob Watson, who is following events from Oxford for us. Rob, over the weekend, I fielded a number of calls and emails from friends and family around the world saying, what are you doing in the UK? Why is it so different from everywhere else? How is the government justifying its different position?
I think Britain is an outlier, and it's justifying it, the politicians are, by saying, look, that is the scientific advice that we have been given. And essentially that scientific advice, the UK's position appears to be, look, you cannot stop completely the transmission of the virus, so the whole point of the strategy should be to try and control it, so you just don't get Britain's healthcare system sort of entirely flooded and overrun in the space of a week or two to try and spread it out. In other words, their argument is, look, yes, you could keep everybody inside for a few weeks, but as soon as everybody went outside again, the virus would come back. So that, of course, is their position. But scientists here in the UK and scientists in other parts of the world disagree.
We're hearing there will be a daily briefing now for the public, Rob. What have you made so far of kind of the communication coming from government and the messaging?
I guess it's a sort of red cross somewhere, a green tick somewhere, and then a red cross recently. What do I mean? I guess critics will probably say that the government here in the UK was a little bit slow at the start of this to get its messaging right. The green tick then comes from saying to put the government's two chief scientists at Mr. Johnson's side and everything was a smart idea, a good idea to put the experts there, but that just in recent days that perhaps the government had lost control of getting the message out there to the public. What exactly is the point of government policy? Is it to stop the disease, to slow its spread? What on earth is it? So I think that's why you're now seeing the government moving to this idea of daily news conferences.
Rob, good to see you in Oxford. Thanks so much.